Several makers of weight loss drugs tumbling after EU regulators said it will expand its review of drugs used to treat obesity and diabetes after reports of some patients experiencing suicidal thoughts. Shares of Novo Nordisk, which makes Ozempic, and Eli Lilly, the maker of Mounjaro, both sliding in yesterday's trading. There's also a separate study showing that many users of anti-obesity drugs stop taking them after a year. Let's find out what this could mean for the sector. Let's bring in Mizuho Securities healthcare sector specialist, Jared Holtz. Jared, always good to see you. Let's start off with the Novo Nordisk study. What are we expecting? Because we are looking for another set of data which will reveal whether or not there are cardiovascular benefits to taking this drug a little bit longer term.
Yeah, Melissa, thanks a lot. Good morning. So this study is really important. This is going to show how well the drug is working versus placebo for patients with a variety, in a variety of cardiovascular outcomes. So we're going to know over a 2-year period how the patients on the drug are doing versus patients that are not taking anything. And hopefully there's a big enough separation, a big enough divide in those two patient populations that will, tell payers, tell insurance companies, listen, there are significant benefits here for patients, and we're going to, cover these drugs more fully. Right now, it seems like most patients that are on them are probably on them as much for vanity reasons as they are for actual therapeutic reasons. Mm-hmm. So this Novo Nordisk trial could really expand the market significantly if we see a big enough variance between the two patient populations here.
So basically, just to underscore this point, because this is really crucial for the drug, if it is shown that there are profound or distinct cardiovascular benefits, then that will increase the chances that these very expensive drugs right now will in fact be covered by insurance, therefore opening up the addressable market. Is that correct?
That's right. That's exactly right.
Okay. So when are we expecting these results to be out?
Those results should be out in the next month or so. The timing is not perfectly clear. But, the latest that I've heard on this is like at some point this summer, early fall. So fairly soon. Okay.
So is this in Novo stock at all? And how does this other separate study showing that patients come off of it in 12 months, does that play into this at all?
I think it's somewhat in the stock. I mean, Novo and Lilly have both been rocket ships, especially, versus the other peers in large cap pharma. I think both stocks, go up to the tune of, potentially 10%, maybe a little bit more, if it seems that the drug arm is clearly benefiting. These patients are experiencing cardiovascular episodes at a much lower degree than those that are not on the drug. I mean, that would basically prove that if you start taking these, despite potentially what your BMI is, that you're receiving significant health benefits along the way. That's really crucial for insurance companies because they don't want to pay for other therapies, and this would kind of, tell them that if you take Ozempic or one of these other drugs, then your likelihood of taking a bunch of other therapies along the way is reduced. And so their cost doesn't go up as much. If not, it's going to be tougher. These other reports are around getting off in 1 year. I mean, not that surprising. If you see the weight loss results that you want to over a year, I think the, proclivity for most patients would be, stop treatment, see how you feel, maybe make some better decisions with respect to lifestyle choices, diet, exercise, and then, go back on the drug as needed. To me, it's almost like an as needed drug. I'm not really sure how many patients outside of the, morbidly obese are going to use this chronically. So I wasn't ultimately that surprised by that.
Jared, do we understand the actual neurological mechanism for this? And I mean, I've seen SSRIs and antidepressants that have this weird characteristic of causing suicidal thoughts. Are there neurotransmitters? I guess there must be. If it makes you feel like you don't want to eat, by definition, there's some brain activity there with neurotransmitters. So is that what they tie it to? That does sound dangerous to me, just to lose a few pounds.
I mean, I think there's probably some light connection. The thing that makes me feel a little bit less concerned on this, I mean, I do think we have to continue to monitor it, obviously. But the thing that makes me a little bit less concerned is that these drugs have been used for diabetic patients for many years. And so,
right.
Moving into the obese population,
Yeah, we probably know if there was you just do the math on any type of percentage, and you would say, what about a much lesser and more cosmetic thing, but Ozempic face? I read about that. I don't want Ozempic face. I've got enough problems. But if you all of a sudden look all sallow and you know, like corpse-like, what?
I mean, that's like my baseline, so I kind of understand that. But I don't know. I mean, I think if you're very, very heavy, you've got other issues to deal with. I mean, I think again, a lot of this is patients that are taking the drugs that probably are more borderline, and so if they have events on the other side, it is what it is.